Humanitarian aid organizations around the country are facing budget shortfalls after major cuts in federal funding, including in our area.
Tigard-based Medical Teams International says it's been stripped of millions. Fox 12's Riel Creighton talked to the organization's leaders about how it's impacted their work around the world.
You may have seen their mobile health clinics. Medical Teams International provides everything from dental care to vaccinations right here in the Pacific Northwest, but their reach is worldwide. We're in countries from Colombia, Ukraine to Sudan. They provide life-saving food, medicine, and reproductive care. Care that's now compromised as they try to navigate a new landscape that means limited financial support from the federal government.
We get a little bit of everything in here.
Inside this facility in Tigard is Medical Teams International and a warehouse full of medical supplies where volunteers pack, sort, and prepare equipment for transport to some of the poorest regions in the world.
What do we have in here? Again, more respiratory tubes and tracheotomy tubes.
What was your first reaction when you heard that you guys were
potentially having to stop our programming in 3 countries? We were saddened to see pauses happen in our funding because we know every cent, every dollar is so critical to providing life-saving medical care.
Care they're now scrambling to sustain as usual, but even more so after losing $13 million in the months since President Trump took office. Among the many humanitarian aid organizations that saw their funding slashed or severed completely as the Trump administration dismantled the U.S. Agency for International Development, USAID.
We have people facing crisis and they're desperate.
Desperation that runs deep here.
It was a death sentence to the Sudanese most vulnerable people.
This is where Dr. Robert Lukwata works, serving at a Medical Teams clinic in eastern Sudan, a country embedded in a years-long, bloody and brutal civil war.
The bombs and guns, you hear them just behind the door, just close to the door. And you are trying to save a life, but you also try to hide to save your own, save yourself.
There is no government, he says, and nearly all basic services are funded by donors, mainly the U.S., much of which has now evaporated. Video shows mothers waiting outside of one of their Sudanese clinics for nutrition assistance. Dr. Lukwata says they give the essentials. It's about survival.
People come in with a lot of trauma, with the wounds, with the history of gender-based violence. They are at the borderline. Famine.
The impact of U.S. withdrawal from Sudan, he says, was almost immediate.
We are seeing high levels of malnutrition in children and pregnant women, beyond what you can say the normal levels, because it's at catastrophic levels.
It has been a challenging 8-9 weeks.
Back in Oregon, their work has not stopped, but there is new pressure. In Portland, on this night, they work on the pivot. A gala, a fundraiser, now more important than ever, to raise money.
You're not prepared, but as a leadership team, we hunkered down and figured out how do we make it through this.
They know what happens here saves lives a world away.
Our hands are now tied. We have no funding to provide the services, so they understand that. But there is a feeling of abandonment by the international community, but also by humanity,
Medical Team says they continue to serve in every country that they had before, but they are working hard to fill the gap. The pullback on foreign assistance has strained them, however, in other ways. As other aid organizations have pulled out due to funding, in some countries, they're the only ones left. Riel Creighton, Fox 12 Oregon.